My name's Heather Thiessen, and I became a patient advisor after experiencing good and bad experiences in the health care system. One incident in particular that stands out for me was I had a line infection, and upon entering emergency we were told that I'd have to stay and have antibiotics, and I asked what would happen if I did leave, like do a treatment and leave and then come back, and the doctor said I would die if I left. And he walked out the room and I broke down, and we never started treatment until the next day, and I never got to see my kids in their outfits and spend Easter morning with them. And it was through that experience that I knew nobody needs to be treated like that, and I would start that journey to make sure no one is.
The whole concept of how to develop a healthcare facility where you're inviting the community to come in and participate. I've never heard of that till now, and I'll never forget this, ever. I'm thinking to myself, to my grandchildren 10 years down the line, if they're coming through, I helped do that over there. I put the models together, you know, and it's always going to be here with me. There's two improvement events that I have participated in, and one would be a 3P, and that's changing a process in the healthcare system. Another avenue would be the RPIWs, which is the Rapid Process Improvement Workshops, and I've been fortunate enough to do 4 of those. On the Monday, everybody meets and you meet your team, and you get some learning on the different things you'll be doing during the week, like timings and different ways of trying to make improvements. And so days 2, 3, and 4, you're on the unit every day and you're asking questions, trialing improvements, trialing different ways of doing things, talking to staff, seeing if they would like it. And although you're only there for 4 days on the unit, the improvements that happen is remarkable.
So there was some things that I kind of were bugaboos to me that I wanted to see, if I could help them accomplish, I would like to see happen. And this unit was one of them. When the suggestion was made for this corner, I just jumped at it. I said, yeah, you have to try it, because it allows family. The other spot never allowed family. There's no room for that. Here we will have that. So the rest will have that, which will be good.
The RPIW event week is very flexible for the advisor on the team. Myself, I have treatment weekly, so I leave for half the day, get my treatment, and they're very aware that I may need a break or I may need to go and have a rest, because it sometimes gets intense. People are there from all different areas in the hospital sometimes to work on these improvement workshops, and I find out they're just as scared as I am. They're intimidated as well, and so we kind of go in together, kind of blind, and we come out friends, and I have new friends from it.
I am a single mom of a 3-year-old daughter named Alina with cystic fibrosis. She is 100% my drive as to why I decided to get involved. It's a very rewarding and surprisingly rewarding thing to be a part of. Didn't expect this level of self-satisfaction coming out of it, and it's just really, I consider a blessing to be able to be a part of it, and I wish more could.
As a patient, I have an opportunity of giving my views, things I'd like to see in this clinic, not only for myself but for all the other patients that are going to attend this clinic. Some point in time, once this clinic gets built and in operation, I will be very proudly able to go to that clinic and drive by that clinic and say, you know, I had an input into this, and I'm very proud of it.
I think it's exciting to be part of this community. The patient's voice is so strong and is so needed when talking about improvement in healthcare. People respect what I have to say, and they will actually stop in the middle and say, "What do you think, Heather?" And that's huge to me. That means that that my thoughts really have value and my ideals have value, and that the road that we're taking on with patient and family-centered care and improving healthcare with the help of patients and families is working and will succeed.